The new trend of COVID-19 patients being diagnosed using antibody rapid tests is emerging and is of great concern to the Ministry of Health as the fight continues to contain the daily rise in new infections. Head of Internal Medicine and Cardiology at the Georgetown Public Hospital, Dr. Temika Rodney, during a virtual public health education session on Wednesday, underscored that while the rapid test can indicate in a sample of blood if an individual has produced immunoglobulin M to COVID-19, it does not detect if someone is currently infected with the virus. Immunoglobulin M, IgM, is one of the several isotypes of antibody, also known as immunoglobulin, that are produced by vertebrates. IgM is the largest antibody, and it is the first antibody to appear in the response to initial exposure to an antigen. It is also the defense mechanism produced by the body in response to the COVID-19 infection, which is usually developed 7 days after being exposed. The immunoglobulin M starts to rise at 7 days, peaks at 14 days, and disappears by 21 days. In addition, Dr. Rodney explained that the body then develops a long-term defensive mechanism, which is also known as the immunoglobulin G.
Your body also starts to produce soldiers to fight in the long term, and that starts about between week 2 and 3. It goes up, and if you're lucky, it can continue for a long time. So we are finding out that it can last for as long as 4 months, 6 months, and it can persist and prevent you from getting infection again.
Dr. Rodney further explained that taking a rapid test 7 days after being exposed can mislead persons into believing that they are not infected.
In this first 7 days, most people don't know they have any infection. And if you test here with the rapid antibody test, you will not find anything positive, and you will go away with a sense of false security that you are negative and nothing is wrong. But you would have already had viral particles that can infect your friends, your family, etc.
He informed that the rapid tests do play a role in the late stages of the infection.
It is not useful in the early part of the infection, and later on it can have very useful purposes in determining infection rates in population and more epidemiological science.
In Guyana, the polymerase chain reaction test is the only method approved to ascertain the status of persons suspected to have the virus. Anyone with symptoms of COVID-19 should have a nasal swab and PCR test done to definitely ascertain their status. The PCR test detects the virus's genetic material. Temika Rodney reporting for the HGP Nightly News.